Welcome back to Upfront. Well, it sure looks like Republicans and Democrats are digging in over a Medicaid expansion in Wisconsin. Governor Evers in his budget proposed taking federal money available through the Affordable Care Act. He says this will help Wisconsin cover an additional 82,000 people. Republicans oppose the Medicaid expansion, but on Thursday, the governor, flanked by Democrats, said he's not giving up.
I'm going to fight like hell for Medicaid expansion. I need your help to get it done. I need you to call your legislators.
Republican Speaker Robin Vos, flanked by Assembly Republicans, doubled down.
He ran saying, 1 by 1%, that he wants to have a massive welfare expansion. Those of us who control the legislature ran saying we do not want to expand welfare in Wisconsin. So ultimately it takes two to tango, and we are not going to give in just because Tony Evers continues to use misleading rhetoric about what the impact would be on the insurance market.
Robin Vos's will is not the will of the people of Wisconsin. I believe we can change this. We're on the first step.
The Republican co-chairs of the powerful Joint Committee on Finance also said they will strip more than 100 fiscal or policy provisions from Evers' budget when they meet on Thursday. That would include the Medicaid expansion, Evers' plan for medical marijuana, and driver's licenses for people in the country illegally. We're talking more about the budget battle ahead with our editorial partner, J.R. Ross of WisPolitics.com. He's at our Madison affiliate, WKOW-TV. J.R., thank you for joining us.
Anytime.
So we heard the governor there, some strong words. He wants people to put pressure on Republicans to get this Medicaid expansion through. Will that work?
From what I can tell and talk to people this week, not likely. The question, though, right now is whether there's some room for Republicans to move toward an expansion or toward a plan that might draw down more federal money without doing a true expansion of the Medicaid program, because they see this as expanding the welfare rolls and they have a philosophical problem with doing what Evers is proposing.
And that was something I wanted to ask you about. There's been some talk about models in other states. So you think Republicans could maybe be looking elsewhere and coming up with a plan that expands Medicaid, but just maybe not exactly how the governor wants it?
Well, remember, Medicaid is a partnership with the federal government. There's a mix of state and federal dollars in there. And so some states will look at things like using private insurance, for example, to use the money in the program to pay for private insurance for those folks who qualify. The thing here is, though, Republicans 6 years ago, when Governor Walker was still in office, eschewed the Medicaid expansion for a model in which they covered everybody under 100% of the federal poverty limit with Medicaid. And then they did this window of folks who could have qualified for the expansion otherwise and put them into the exchanges under the Affordable Care Act. They see that as more of a model they like, that it's more sustainable financially. The issue, too, is they're arguing now that what Governor Evers wants to do would take people who are already on the exchanges and put them on to Medicaid. One of the problems for Republicans is they have a messaging issue. With Governor Evers in his position, it's very simple to explain to people. If you do the expansion, you would cover more people, about 82,000 with Medicaid, and it would save the state money, more than $300 million. That's a very simple message to have. Republicans have tried so far and not done a very good job of it to explain their side in a different way. So what you're going to hear more from them is talking about, well, what Evers wants to do is an expansion of welfare, for example. They're going to talk about the options that are already available to people. They're trying to find a better way to position themselves that they can make an easy explanation to the public about why their way makes sense, rather than very easy to understand, more federal money, more people covered, that Evers is talking about.
Do you think at the end of the day they'll expand Medicaid in any way?
I get the impression that there are some Republicans who want to find a way to draw down more federal money. Like, remember, because of that mix of federal and state dollars, the more state money you put in for Medicaid, the more federal money you get. That allows you to do things, for example, like increase reimbursement rates for hospitals and nursing homes. We have a very low reimbursement rate in Wisconsin. That's a problem for the healthcare industry. So how can they find more money to put into it? For Governor Evers, it's very simple. This Medicaid expansion, accepting this money, is part of a $1.6 billion investment in healthcare. That's, again, a simple argument to make. For Republicans, can they find some way to put more money in that would draw those federal dollars and allow them to do things like the reimbursement rates? So maybe they find some kind of hybrid model where they try and find ways to get more people onto these exchanges that are not taking advantage of them, for example. Maybe they find something where applying for a waiver from the federal government to try something new. The issue is, here we are, early May. The budget should be on Evers' desk by the end of June. we don't have an alternative from Republicans right now. So they have a very short window to find an alternative to what is on the table, either what Evers wants to do or what Republicans already have in place with Governor Walker and the plan they did 6 years ago. The other thing is with Speaker Robin Vos in the Assembly, he has drawn a bright line about this issue. He has said absolutely not on the expansion of Medicaid. So what could you do that would maybe Robin Vos could agree to and some Republicans without backtracking from that very bright line he's drawn of absolutely no way, #never, would he expand Medicaid under the way that Evers is proposing?
And we have heard mixed things from Republicans at times, and we know that there are some moderates in the Senate. So do you think that they will compromise and at the end of the day broker a deal in this?
Unlikely, because it's a numbers game. If you look at the two caucuses in the Senate, you have 19 Republicans. You have to find 17 who would vote for anything, and right now I don't get the impression there are 17 Republican votes in the Senate Republican caucus for Medicaid expansion. Same thing in the Assembly. There are more than 60 members there, but I don't see 50 votes from people I talk to do what Evers wants to do. There are definitely wings of those caucuses that want to do some kind of expansion or a hybrid model or something different. But again, until you hit those magic numbers of 50 in the Assembly and 17 in the Senate, there's not a path forward to do something that would be different than what we're doing right now.
J.R. Ross, thank you.
Anytime.
Next, the governor and the chairman, the Foxconn chairman, meeting for the first time.